Welcome to the Highlights Show. I'm Phil Kessler.
And I'm Amy Ryan. It's great to be here. Wow, okay. Just finished watching that webinar on India's TB elimination efforts. And honestly, what really jumps out is just the sheer scale, but also, maybe more impressive, the ingenuity.
Yeah.
Especially how they're mixing, really advanced tech with like fundamental community work. It gave me a lot to think about.
I absolutely agree. It's not every day you see something that feels so comprehensive and so grounded in what's actually happening. You hear about global health challenges like TB, and they can sound almost impossible to solve. But that felt like a real practical strategy in action. Shows a complexity, sure, but also some brilliant thinking.
Right. Okay, so let's unpack some of that. The tech part really caught my eye. Those AI-powered handheld x-rays. It's not just theory, is it? They're actually changing how diagnosis happens on the ground. What struck me was the speed. Cutting down screening time, getting rid of those reporting delays almost completely. That's huge for TB. Getting results fast, taking action almost in real time.
Exactly. Near real time.
And the whole setup with the mobile camps, daily camps, sometimes hundreds of x-rays a day. That's amazing. Plus, making them solar-powered so they can reach places totally off the grid. It's this mix of super high-tech AI and really practical, almost low-tech deployment, like bringing the lab right to people's doorstep.
And what's fascinating there, you really hit on it, is the why. Why push this tech so hard? It's not just about being faster for the sake of speed.
Yeah.
It's about breaking down those critical logjams in diagnosis that have always been a problem.
Right.
For you.
The bottlenecks.
Yeah. So the AI helps triage the x-rays instantly. They said it cut the reading time down from minutes to about a minute per image, especially with new hardware. Think about that impact. It lets them connect patients to the next step, testing, treatment so much quicker. In places without easy access to hospitals or labs, this kind of innovation, well, it's how you genuinely reach people who need it most. Saves lives, really. It's a game changer for access.
Okay, but then there was this other part that felt like a really big strategic shift, maybe even bigger, moving beyond just finding people who are already sick, who have symptoms, to actively screening high-risk groups, even if they feel fine. The goal being to find not just hidden active TB, but also people with TB infection.
Latent TB, yeah.
Exactly. So they can offer TB preventive therapy, TPT. They mentioned the 3HP regimen, the shorter one, it feels like. Like they're trying to stop the problem before it even starts, sort of closing the tap, not just mopping the floor.
That's a really critical point.
Yeah.
And if you look at the big picture in public health, this move towards TPT is, well, it's a major evolution in fighting TB globally. Finding and treating active cases is vital, of course. You have to stop the spread. But if you want sustained control, you absolutely have to tackle that huge reservoir of latent infection. So yeah, you're spot on. It's population-level prevention. It shows they're thinking long-term, not just reacting.
Makes sense. But I remember one tricky point they brought up, a real challenge. What do you do when you find something on an x-ray, some abnormality, but the person has no symptoms? Often they can't produce sputum for the molecular tests, the really accurate ones, and doing something like a bronchoalveolar lavage, well, that's invasive and just not feasible for screening lots of people.
Right. Totally impractical at scale.
So these people end up needing, like, clinical follow-up instead of a quick confirmed diagnosis. That sounds like a tough spot operationally.
It absolutely is. It really highlights that even with amazing tech, you get these real-world complexities. Those x-ray findings in asymptomatic people, they're like red flags.
Yeah.
But without sputum, confirming active disease is hard. So clinical follow-up becomes essential, but it's resource-intensive, right?
Yeah.
Needs careful monitoring, maybe repeat scans. Sometimes doctors have to make a judgment call on treatment without definitive proof. It's very different from the straightforward test and treat for symptomatic cases. It's a diagnostic tightrope. And it shows the kind of challenges you face when you're really trying to eliminate a disease, digging deep for those harder to find cases.
Yeah, definitely. Okay, shifting gears a bit, though, to something that was really inspiring in the webinar, the human side of it all. All this tech is great, but they really hammered home how crucial the community mobilization is. It's not just about having the tools, it's getting people to actually engage, to participate. Trust. It's all about trust.
Totally. And they talked about so many ways they build that. Youth campaigns using like social media reels, big LED screens in cities, radio partnerships, celebrity endorsements, even getting young people to design the outreach materials themselves in workshops. That's smart. And you could see the commitment from local leaders, from the staff. They mentioned volunteers, people like Antrik coordinating mobile camps, just going above and beyond.
The recognition systems help too, I bet, keeping morale high.
For sure. And I thought it was powerful seeing the leadership roles women were playing too. Female officers, community health workers being those trusted faces in the community.
That's such an important piece because it begs the question, right? How do you get buy-in for something like this, especially with a disease like TB that still has stigma attached? And the answer, like we saw, is tackling that stigma head on, building trust. That whole multi-pronged advocacy effort involving local government, police, politicians, youth groups, the media, it's essential. It normalizes screening, yes, but it also mobilizes resources and changes how people think about the disease in a way clinics alone can't.
We heard about similar things elsewhere too, didn't we? Like Nigeria's first lady getting involved or those community champions in Kenya. It just reinforces that universal point.
Right.
Tech needs people. It needs that strong, engaged human element to work.
Absolutely. But, even with the best strategy and amazing people, there are always roadblocks. The webinar was pretty open about the challenges they still face, practical stuff, things like supply chain issues for the test kits, those SIATB and PSYTB kits they mentioned. If those run out, things grind to a halt.
Yeah, that can stop everything. And staff shortages, equipment breaking down in remote areas, not enough capacity for all the molecular testing needed. It's a reminder of the real-world friction.
It is. And it's important to see those not as failures, but just the reality of running massive health programs, right?
Yeah.
They talked about needing ongoing investment in basics, reliable power, maybe solar backups, good tech support for the machines. Plus, you can't just scale up testing without scaling up the trained people to run the tests and interpret them. And they also mentioned how things vary so much place to place. Different districts, different states have different levels of TB, different program maturity. That affects results too. It just shows that progress isn't always a straight line. You're constantly adapting, which makes what they are achieving even more impressive, I think.
So thinking about all this, what's the takeaway for us, for you listening? What really came through for me from that webinar material was this picture of a truly joined-up approach. It's not just the fancy tech, it's how they weave it together with smart public health strategy and really deep community work. Honestly, it's inspiring to see that kind of integrated effort against TB.
Yeah, it really is. And maybe a final thought for you, the listener, to chew on is this, that delicate balance. How do you invest enough in the high-tech diagnostics, the preventive therapies, while also making sure you're strengthening the basic human stuff, the logistics, the community trust on the ground, because it feels like you absolutely need both for that ultimate goal, really controlling the epidemic by treating infection at scale.
Yeah.
They seem totally interdependent.
That's a great point to end on. And honestly, we've only really skimmed the surface here. The actual webinar, hearing from the people involved, the real stories from the field, the lessons they shared, it adds so much more depth. If you're interested in how these big health programs actually work, the practical side, the innovations, it is definitely worth watching the whole thing. Start to finish, you'll get a lot more out of it.